Another day, another story. Pathophysiology of hypertension. Hypertension is a complex medical condition that involves various mechanisms and pathways that regulate blood pressure. Blood pressure is regulated by a combination of factors including the cardiac output, peripheral resistance, and blood volume. Here are some of the key mechanisms involved in the pathophysiology of hypertension. Blood pressure regulation. The body's main mechanism for regulating blood pressure involves the renin-angiotensin-aldosterone system, RAS, the sympathetic nervous system, SNS, and the regulation of fluid and electrolyte balance by the kidneys. Renin-angiotensin-aldosterone system, RAS. When blood pressure decreases, the kidneys release renin, which leads to the production of angiotensin II, a potent vasoconstrictor that raises blood pressure by constricting the blood vessels. Angiotensin II also stimulates the release of aldosterone, a hormone that promotes sodium and water retention in the kidneys, which further increases blood pressure. Sympathetic nervous system, SNS. The SNS plays a key role in the regulation of blood pressure by increasing cardiac output and peripheral resistance. When the SNS is activated, it leads to vasoconstriction, increased heart rate, and increased contractility, which all contribute to raising blood pressure. Endothelial dysfunction. The endothelium is the inner lining of blood vessels and plays a key role in regulating blood flow and blood pressure. Endothelial dysfunction, which is characterized by impaired nitric oxide production and increased inflammation, can contribute to vasoconstriction and hypertension. Sodium retention. Sodium is an important electrolyte that regulates blood pressure by controlling fluid balance. When sodium intake is high, the kidneys retain more sodium, leading to an increase in blood volume and blood pressure. Genetic factors. There is a genetic component to hypertension, with several genes identified that are associated with blood pressure regulation. Overall, hypertension involves a complex interplay between various mechanisms and pathways that regulate blood pressure, and understanding these mechanisms is important in developing effective treatment strategies. Diagnosis and evaluation of hypertension. Diagnosis and evaluation of hypertension typically involves several steps to determine the severity of the condition and its underlying causes. The following are the usual steps in the diagnosis and evaluation of hypertension. Blood pressure measurement. The diagnosis of hypertension is based on the measurement of blood pressure using a sphygmomanometer. A diagnosis of hypertension is made if the average of 2 or more blood pressure measurements taken at separate visits is greater than or equal to 130/80ths. mmHg. Medical history. A medical history is taken to determine risk factors for hypertension and to identify any underlying conditions that may be contributing to elevated blood pressure. Physical examination. A physical examination is conducted to assess for signs of end organ damage, such as retinopathy, renal impairment, or heart disease. Laboratory tests. Laboratory tests may be ordered to identify any underlying conditions that may be contributing to elevated blood pressure, such as diabetes or kidney disease. ECG. An electrocardiogram, ECG, may be ordered to assess for any underlying heart disease that may be contributing to elevated blood pressure. Ambulatory blood pressure monitoring, ABPM. ABPM involves wearing a blood pressure cuff that measures blood pressure at regular intervals over a 24-hour period. ABPM may be used to confirm the diagnosis of hypertension and to assess blood pressure control over time. Imaging studies. Imaging studies, such as echocardiography, may be ordered to assess for any structural abnormalities that may be contributing to elevated blood pressure. The evaluation of hypertension aims to determine the severity of the condition, identify any underlying causes, and assess for any end organ damage. Treatment strategies are then developed based on the severity and underlying causes of the hypertension. Classification of hypertension. Hypertension can be classified based on the severity of the condition and the underlying causes. The following are the two main classifications of hypertension. Classification by blood pressure level. Based on blood pressure level, hypertension can be classified as follows. Normal blood pressure, less than 120/80ths of a millimeter of mercury. Elevated blood pressure, systolic blood pressure, SBP, between 120 to 129 millimeters of mercury, and diastolic blood pressure, DBP, less than 80 millimeters of mercury. Stage 1 hypertension, SBP between 130 to 139 millimeters of mercury, or DBP between 80 to 89 millimeters of mercury. Stage 2 hypertension, SBP of 140 millimeters of mercury or higher, or DBP of 90 millimeters of mercury or higher. Hypertensive crisis, SBP over 180 millimeters of mercury and or DBP over 120 millimeters of mercury. Classification by underlying causes. Hypertension can also be classified based on the underlying causes, and the following are the main types of hypertension based on underlying causes. Primary or essential hypertension. This is the most common form of hypertension and has no identifiable cause. It is believed to be related to a combination of genetic, lifestyle, and environmental factors. Secondary hypertension. This type of hypertension is caused by an underlying medical condition such as kidney disease, adrenal gland tumors, or sleep apnea. Gestational hypertension. This type of hypertension occurs during pregnancy and usually resolves after delivery. White coat hypertension. This occurs when blood pressure is elevated in a medical setting, but normal when measured outside of the medical setting. JNC7 classification. JNC7 refers to the 7th report of the Joint National Committee on Prevention, Detection, Evaluation, and Treatment of High Blood Pressure. JNC7 is a set of guidelines for the prevention, diagnosis, and treatment of hypertension. The JNC7 classification system categorizes hypertension based on blood pressure readings as follows. Normal blood pressure, less than 120/80ths of a millimeter of mercury. Prehypertension, SBP between 120 to 139 millimeters of mercury, or DBP between 80 to 89 millimeters of mercury. Stage 1 hypertension, SBP between 140 to 159 millimeters of mercury, or DBP between 90 to 99 millimeters of mercury. Stage 2 hypertension, SBP of 160 millimeters of mercury or higher, or DBP of 100 millimeters of mercury or higher. The JNC7 guidelines also classify hypertension based on the presence or absence of certain risk factors, such as diabetes or kidney disease, and recommend different treatment strategies based on the patient's overall cardiovascular risk profile. In general, lifestyle modifications, such as weight loss, dietary changes, and increased physical activity, are recommended for patients with prehypertension and stage 1 hypertension, while pharmacologic therapy is recommended for patients with stage 2 hypertension or high cardiovascular risk. ACC/AHA classification. The ACC/AHA, American College of Cardiology, American Heart Association, classification system is another set of guidelines for the prevention, diagnosis, and treatment of hypertension. The ACC/AHA guidelines were updated in 2017 and categorize hypertension based on blood pressure readings and overall cardiovascular risk as follows. Normal blood pressure, less than 120/80ths of a millimeter of mercury. Elevated blood pressure, SBP between 120 to 129 millimeters of mercury and DBP less than 80 millimeters of mercury. Stage 1 hypertension, SBP between 130 to 139 millimeters of mercury, or DBP between 80 to 89 millimeters of mercury. Stage 2 hypertension, SBP of 140 millimeters of mercury or higher, or DBP of 90 millimeters of mercury or higher. In addition to blood pressure readings, the ACC/AHA guidelines also take into account overall cardiovascular risk factors when making treatment recommendations. The guidelines Suggest using a risk calculator to estimate the patient's 10-year risk of atherosclerotic cardiovascular disease, ASCVD, and to determine the appropriate treatment approach. Treatment strategies may include lifestyle modifications, such as dietary changes, increased physical activity, and weight loss, as well as pharmacologic therapy based on the patient's overall cardiovascular risk profile. Thanks for watching.